one of the things I'd like to emphasize here to the viewers is that infertility is a diagnosis of a couple, not an individual.
Oh, okay. That's
So
a good point to note.
it is very important because when we investigate, if for instance we were to investigate and find the man has a low sperm count or no sperms, then it doesn't mean it is the man who is infertile. It still remains that that couple cannot conceive. If we investigate and we find the woman has damaged tubes, then again we would say it is not that woman who is infertile, it's a couple.
So you don't separate.
You cannot separate the couple because even the solutions must be sought for the couple. It is not for the individual person.
Welcome to the month of love. And I know during this season, love is in the air. But I hope it's not just during this season, but this is something that you and I should be experiencing. And who knows, maybe it might be of great benefit this time around for you to focus on giving love rather than receiving it in this season that we are in. Now, we would like to focus on an issue and a matter that is affecting us, Daktari, generations and generations, but more so quite prevalent in this day and age. And this simply has to do with couples struggling to get pregnant. And it is possible that those who are watching, their question is simply this: I am struggling to get pregnant. And I know many of us out there are looking for solutions. They are craving for solutions. We are all headed to that global dictionary, Google, and trying to find solutions. And we have all sorts of information out there. But today we have one who is tested and tried. The gentleman with us today, his name is Dr. Wahome Ngare. He is a renowned gynecologist. He is a full-time private practice at his own hospital called Mercy Medical Center, situated at Cardinal Otunga Building, right at the heart of CBD, and it's truly a joy. Karibu sana, Daktari.
Thank you very much.
Yes, sir.
I'm happy to be here.
Awesome.
Yeah.
So let's begin.
Yes.
Why don't you just share with us an overview of what are the most common causes of infertility?
Yes, well, maybe we start with understanding infertility. When a couple has been together for a period of 1 year, having regular sexual relations, and have not conceived, then we get worried. We get even more worried if we are able to teach them to understand their fertility, for the woman to be able to recognize when she is fertile. And they actually meet during that time of fertility for 2 to 3 months, and they still don't conceive. Then we think there is a problem. Now, if you look at the way the body is structured, it's the easiest way to formulate the causes. So the woman has to receive the male seed, so the man has to have his sperm and a good sperm count. And then this seed must travel through the uterus to the tubes, through the tubes to get to the egg that is usually in the fallopian tube. So the uterus should be normal, the tubes should be open, and then the woman must ovulate to release the egg that will then be fertilized. If any of those things are missing, then we would end up with infertility. The commonest cause by far is obstruction of the tubes, and that has always been the highest. But we're beginning to see a little more of what we call hormonal imbalance, where the women are not ovulating on a regular basis, contributing to infertility. So the man may not have sperm, or he may have a low sperm count. The tubes may be blocked, or the woman may not be ovulating on a regular basis, mainly because of the hormonal systems. Yes.
Wow. And I'm just thinking, for a new couple, are there early signs that one should not ignore they're like telltale signs. So here you are, a man and a woman, they've never tried it before, getting children. And they're excited, and you can tell there will always be one or two statements from a few relatives here and there, saying that now that you've crossed this hurdle, you're now husband and wife.
Yes.
We expect to see the fruits.
Yes.
So are there early signs that somebody can even take note of, even before saying I do?
Well, not really. I think because for the man it's very hard to know, because so long as one gets an erection, and that would be something that one would notice in the morning, they should be fine, because it's only impotence that would be the other thing. And if you're impotent, then you have no business marrying anyone. And where impotence means that you cannot get an erection to have sexual intercourse. For the woman, the telltale signs might be menstrual irregularity.
Okay.
If there is menstrual irregularity where her periods are not regular, where she's keeping her periods over 2-3 months, or she's bleeding and bleeding continuously for long periods of time, those are usually the early signs that there could be a hormonal issue. Women who understand their fertility and who can tell when they're fertile, because fertility has its own signs, would notice that they've gone from one period to the next without ovulation. That can tell a woman that there is something that is happening, and it is better to have it investigated.
Okay.
Yes.
And just to build up on that point, how would you say infertility is diagnosed? And if you had a couple and they suspect they have these fertility issues that you have just highlighted and raised, what steps should they take, or what steps should that individual take? As we said, you've spoken about issues to do with irregular menstrual cycles. Yes.
Well, the thing is, one would never be able to diagnose infertility until there has been that attempt to have sexual intercourse. Okay. So the only time we know that a couple is infertile is if they have that regular sexual intercourse and not conceive. So there is no way of testing fertility before. One would have to engage in sexual intercourse. So in a Christian setup, then this would only be known after the marriage, because it is hard to make a diagnosis without attempting to conceive. And that's why we say any young couple who have not been deliberately trying to avoid pregnancy and have been having regular intercourse and a year has passed without conceiving, then they should get concerned and seek assistance. Yes.
Okay. And I'm just curious, what could be causing the spike? Because from what we're hearing from certain circles, from friends, from family, we are witnessing the numbers are rising. We're having more and more couples, and it's quite a point of concern. Even for us as pastors, I can tell you this for sure. When we have people coming over for prayer, if you're to ask a congregation of 500 people, just come forth, and those who need special prayer, you can sense that we're having and witnessing more and more people saying that I am trusting the Lord for a child, I'm trusting the Lord for a baby. We believe in prayer. We believe in the place of trusting in God, because we believe children come from the Lord, as the scripture clearly tells us.
True.
But we're just wondering what's causing this spike? More and more young people.
In fact, is very worrying, and we do not have very clear answers. When I left medical school a few years ago, tubal damage because of infections in the reproductive system. So liberal sexual attitudes, where people are having sex before they get married, would lead to possible damage of the tubes. But we are seeing more and more young couples who were not liberal with their sexual attitude. Some had never had any relationship before, coming, and you examine them and the tubes are open, but they are not conceiving. And again, one of the things I'd like to emphasize here to the viewers is that infertility is a diagnosis of a couple, not an individual.
Oh, okay. That's
So
a good point to note.
it is very important because when we investigate, if for instance we were to investigate and find the man has a low sperm count or no sperms, then it doesn't mean it is the man who is infertile. It still remains that that couple cannot conceive. If we investigate and we find the woman has damaged tubes, then again we would say it is not that woman who is infertile, it's a couple.
So you don't separate.
You cannot separate the couple because even the solutions must be sought for the couple. It is not for the individual person. Okay? So we are seeing a lot more issues of male infertility. When I was in medical school, it used to be a problem of Europeans. They would tell us how the sperm count is reducing in the UK, and we would actually laugh about it. It was such a big joke. And now we're beginning to see a low sperm count, and even some young men who actually do not have any sperm. Now, that is not normal because in nature, what we see is impotence. If an animal has a problem, a male animal has a problem, it would usually be a testicular dysfunction. They're not producing any testosterone. Then they're not able to get an erection. They're not interested in women, in the female, and therefore they will not engage. But where you have a fully functional man who is able to have normal sexual relations, and you discover they have no sperm, then something is amiss. And there is a lot of work the scientists need to do to tell us what is happening. We're also seeing a lot more of hormonal imbalances in women, especially this condition called polycystic ovarian disease, PCOS, is also becoming more common. So,
and the cause is not known.
Yes, the cause is not known. We don't know what the cause. We know the hormonal imbalance it comes with, but if we knew the cause, we would treat it. And then we also have a lot more loss of pregnancies, especially in the first 3 months. We see a spike in couples who are getting pregnant and they're very excited, and you do an ultrasound and you find the baby did not grow beyond a certain point. So very, very strange outcomes that were not there as we began our practice a few years back in 2000 that are becoming almost normal. I was very shocked when a young couple came to me and said they lost a pregnancy, and when they went to tell this to a friend of theirs, they said, "It's okay, even me, I've lost two." It's almost like
it's a norm now.
Is a norm. So that's not normal, and I think those of us in practice really need to ask a lot of questions. There is something we are doing to our children as they are growing up. There is something we are giving our children. There is something we are eating. There is something that is happening that is common across the whole country that is causing problems of fertility, and people really need to take this seriously. Yeah.
Wow.
Yeah.
And I just thought about this. The big elephant in the room. Contraceptives. Is there any correlation? Because I'm thinking maybe some people are saying, and I'm sure that's one of the things that those who are watching could, be thinking about. Does it play a role? Because I can tell maybe in the decade and the generation we are in today, we have more and more people utilizing the same. Does that have an effect? Is there a correlation between the two?
It would be hard to put a direct correlation, but there would be certain relations that you would want to think about. For instance, if one is using contraceptives and they're not married, there is a certain tendency to be a little more liberal in their sexual attitude. There is a higher chance that such a person would end up with more than one partner before they finally settle down, the exposure to many different partners would increase somebody's risk of developing STIs. And gonorrhea and chlamydia are very damaging to the tubes. Okay. We also know that a certain degree of the hormone would find its way into milk. So breastfeeding mothers who are on hormonal contraceptives would actually be feeding their children with active female hormones at a very tender age. And we do not know what kind of damage that would do to the reproductive system of the baby receiving these hormones. So in that essence, yes, most of the contraceptives have been designed to be reversible, and they themselves may not cause sterility of the woman, but there is a way they change our attitudes that can contribute towards infertility. Yes.
Wow. Quite amazing. And as a practicing gynecologist,
Yes.
Just in general, what are some of the common treatments that we have in the country, here in Kenya?
Well, we would treat based on the diagnosis.
Okay.
Now, there is something else that I have overlooked when you asked about causes. There was a time the WHO was conducting a campaign to eradicate neonatal tetanus in this country. 2014, started 2013, September 2014. And the Catholic Church, the Catholic Doctors Association, was very concerned about that because we were aware of a certain fertility regulating tetanus vaccine that had been given in South America. That had been developed, facilitated by WHO. And when we actually tested what they were giving in the field, we found that some of those vaccines they were giving during that campaign were actually fertility regulating tetanus vaccines. And that has led to an issue, because what that vaccine does is it takes tetanus and combines it with HCG, which is the hormone of pregnancy. And when we inject this combined structure into the woman, she develops anti-tetanus toxoid antibodies, which would protect her from tetanus. But she also produces anti-HCG antibodies.
Wow.
Now, what those do is that HCG is produced by the baby when it implants in the mother. Okay, so when the baby implants in the mother, it produces HCG. That's the signal that tells the mother she is pregnant. And it's a signal that makes the woman produce the hormone of pregnancy called progesterone. Now, if you destroy HCG as it's being produced through these antibodies, then what happens is that the mother system doesn't pick the fact that she's pregnant. So if the antibodies are very high, she gets very regular periods without even knowing she ever conceived. As the antibodies reduce, she starts getting very regular cycles as she's trying to conceive. Then after that, we start finding what we call blighted ovums. You have a mother who is pregnant and you do a scan, the baby is not growing. The other thing we get as the antibodies reduce is we start having bleeding in early pregnancy. Now, it is very interesting. When you Google bleeding in early pregnancy, it says it's normal, but people should not bleed when they're pregnant. And when those antibodies attack the HCG, then we get an unstable pregnancy. So you find that's called a threatened pregnancy, threatened abortion. If the baby is alive, then it is possible to treat. And once you understand that this vaccine had actually been used in the country, there is treatment regimes that one can use to reverse that damage.
Okay.
So the treatment would then depend on the diagnosis. If the man has no sperm at all, there is very, very little we can do about it.
Okay.
And even where people have been offered IVF, where they get donor semen, then the baby will actually be that of your wife and another man you don't know.
Oh.
because the baby is not yours.
Yes.
If the problem is with the woman and her eggs, and she gets donor eggs and gets pregnant through IVF, then that baby belongs to her husband and the other woman who donated the egg, isn't it?
Yes.
The mother is just a surrogate.
Yes.
So they are those that are there. When it is the tubes that are blocked, it depends. If they are blocked at the edges, at the tips, which we call the fimbrio ends, then we can always open those up through surgery and see whether we can be able to help make them patent. The easier one to treat is where you have the hormonal issues, where you have hormonal imbalance that is preventing ovulation. You do some hormonal tests, and if you discover which one it is, then you can be able to counter it medically or through diet to see whether the mother would be able to ovulate.
Okay.
So treatment is targeted towards the cause. Where the cause is something that cannot be treated, then one of the easiest options would be adoption, where then the baby doesn't belong to either of you, but needs a home, and you bring this child into your home and become the parents. So you can be a parent without necessarily giving birth, because being a parent is about responsibility. Where IVF has been used is where the woman has blocked tubes, but she has eggs, and the mother has the husband has sperm. These are fertilized outside the mother in a laboratory, then is put back into the mother. It has a lot of moral concerns because they would fertilize maybe about 10 eggs. They would put a maximum of 5 back in the mother. If she gets twins or triplets and decides she doesn't want any more children, what do you do with the 5 that are left in the lab?
Wow.
Okay, so they are babies. The only reason they are not growing is because they haven't been put back in the mother. So there are a lot of those moral concerns. The issue about how the sperm is collected is also through masturbation. So a lot of men would have challenges with giving a specimen. So there are a lot of other moral issues that have to be balanced. So, yeah.
Wow. And just to mention to our viewers that you can as well just pen down your question on whichever platform you are watching us from, and also feel free to like, subscribe this channel or platform that we are on. And now that you mentioned something about diet, and by the way, we know that we will be having a video, I think the third one or something, we will try to discuss something to do with diet and with a person struggling to get pregnant. You mentioned something about vaccines.
Yes.
And that's another dynamic. I don't want to go into the specifics because I know there are certain regulations, especially on these platforms you are on, the moment you mention certain vaccines. First, the tetanus vaccine, is it still there? How long did we have it in the country? And is there also, should we also be concerned about the vaccines that are out here? Are they playing a role with this issue?
It's a very, very dicey area. But suffice it to say that when we were dealing with the tetanus vaccine, it was a campaign to eradicate neonatal tetanus. So what they had done is that they wanted women between the age of 14 to 49 to be given this tetanus vaccine, whether they are pregnant or not. Now, normally we would give each pregnant woman 2 doses of tetanus vaccine if it's her first pregnancy, to protect her and the baby. And therefore, this additional thing was what was causing concern. So as far as we are concerned, it was that campaign. You see, if the country has just 2 million doses of regular vaccines for the regular mothers who are pregnant, and you're asked to vaccinate women from 14 to 49, then it is it means you'd have to make a new order for a new supply of vaccines. That new batch is what we think was coming with the altered vaccine. So remember, the government is ordering through WHO, through UNICEF, or through Gavi. It is ordering in good faith. They have been asked to vaccinate their women with this thing. If whatever is brought is altered, then it is not known to those who are ordering. So everybody is doing this thing out of good faith. It is only when we tested that we found there were some batches. So about a third of them had issues. But that campaign stopped.
Okay.
WHO declared Kenya free of neonatal tetanus 2017.
That's good news.
And that campaign stopped. So
Okay.
we've not bothered to check what is in the market now.
Okay.
But that was an incident that happened, and it was dealt with through both government and the church, and that campaign was withdrawn. Now, the reason we have vaccine hesitancy, and this is something that has been discussed, if any time you question, the right thing in science is for somebody to listen to your questions, to investigate and confirm if there is a problem. For that particular one, we even did a paper and published. But when you raise a question and somebody calls you a conspiracy theorist, you're told to stop asking questions, to stop. That's where the challenge comes. The question is, why would you stop me from asking questions? I am a doctor. I
That's
care
right.
about my patients. And I would want to know what it is I'm giving them. So if you look at the latest vaccinations we had for COVID,
Yes.
they were rolled out before doctors could actually see the results of the trials that were used to approve them. So these drug companies go to the FDA in America. They present them with documents of the studies they've done for their vaccine. They are given approval to roll out this vaccine. And once the vaccine is rolled out, then we do not, as doctors, get to see the material they presented to the regulator. And it did not until somebody in the US went to court and demanded for those documents is when we got to know what was in the trials and what they had seen the vaccines could do. This is coming 2 years after the event.
Wow.
And you find in those the documents that they had presented that almost 80% of women who were pregnant at the time of vaccination in the first 3 months of pregnancy lost their pregnancies.
Oh, sad.
You find women were having irregular menstruation. You find there were problems with heart issues. You have problems with many other issues. And when you look back, you find that some of the women who got the COVID vaccine, almost maybe 50%, reported some element of menstrual irregularity. We also know that the capsule of the vaccine was accumulating in very high quantities in the ovaries, but we don't know what it does there. Okay? What was the mechanism that was causing the pregnancy loss? We don't know. So it is refusing to release some of this information to doctors. If as a doctor I do not have the information I need to tell you that something is safe and effective, why would I be expected to say that because some organization told me it is safe and effective? And if there is damage that has happened after the effect, then for how long will we deal with this damage? And what kind of effect will it have on our children going forward? So that's the problem.
Okay.
The problem is the people who want to know before they prescribe are denied the information, and they are called names, and they are made to look bad. Some of those who are in Europe and other places would actually be removed from service. So it becomes very sensitive.
Wow.
Yeah, so there is a lot that we will get to know many years from now.
Okay, and I like
Yeah.
what you said, ask the question.
Yes.
Ask the question,
Yes.
do your research,
Yes.
and get to know the truth in terms of what it is you're getting and if there are any consequences to the same. Now, one last question very briefly, because
Yes.
I know our time is up. How accessible are these medical treatments? How accessible? And especially for our Kenyan audience, how accessible is this treatment for somebody who is struggling with infertility? I know for some who just sit back.
I think what is important for any couple that is struggling with infertility is to understand that even as we pray, God has given people the knowledge with which to help. So if you have been together for a whole year, you're not on anything to prevent pregnancy, you're not actively trying to prevent getting pregnant, and you're not pregnant, it is important that you seek medical advice. Go and have yourself checked, and you always go as a couple. Never send your wife to go and be checked, or a man sneaks back behind the wife's back to go and be checked just to know whether it is him. Come together as a couple, because the problem is of that couple and it has to be solved as a couple's problem. And once you come as a couple, what we do in our facility is that we train the couple to understand fertility. The body talks to the woman when she's fertile, the same way it talks to her when she's about to get her periods. It's very easy to teach a woman to understand her fertility. Once she understands her fertility, then you encourage them to have sexual relations during that time of fertility. And if she doesn't get pregnant in 2 or 3 months, then we immediately start the investigations. We don't wait for 1 year. Okay, and the man is investigated, the woman is investigated, and then we can quickly find. So all gynecologists are trained in how to make a diagnosis of infertility and try to understand the cause. They are trained in how to treat these causes, where there is need for very special care. And for those who IVF is not considered a moral issue, I generally wouldn't do IVF, but for those who don't find it a moral issue, then we have fertility experts who would then do those IVF and other things. And those are now more available in the country than they were a few years back.
Okay.
And because of that, the cost is coming down. But it will still be ranging about $500,000 to try once.
Okay.
But before you get there is a lot of work that needs to be done.
All right.
The other thing is that people tend to go to one doctor, ask a few questions, try what he said, then disappear, go to another one after 2 years like that. And 10 years later, nobody knows the problem.
The same way we hope from one church to another.
Yes. So the idea is to, within a year, we should have finished the investigations, we should have done all the trials we need to do and known whether this couple can get pregnant or not.
Okay.
At the end of 1 year. It shouldn't take longer than that.
Awesome.
Yes.
Thank you. What a way of winding it up. And what I gathered from Daktari here is that it's not a challenge with an individual, it's a challenge with the couple. And that should mean that we need to move away from the stigma that is out there, that at times we tag a specific person.
Yeah.
That's what I heard from you. And I love what you said. Those two things, if you listen to him very keenly, that do not despise, don't dismiss the place of prayer. Prayer is very critical. Talk to God, trust in God. I mean, we have numerous stories in the Bible of women, of couples who struggled to get children and they trusted in the Lord and the Lord came through for them. But even as you pursue and engage in the place of prayer, the Lord has blessed us with great minds. You know, amazing men and women out here who have learned and, studied how the body behaves and interacts, and you can actually be able to get help. So please don't just sit back and wallow in pity and depression and all these aspects that we find ourselves into when we realize we have a huge, gigantic situation. You can find help. And Daktari here, Dr. Wahome Ngare, is one of the best, I would say, and renowned gynecologists in town. And I know that you'll be able to get his details and also that of the hospital right at the description on whichever platform you are watching us from. And just in case you would also need prayer, please feel free to reach out to us. We will also take time just to pray with you and trust God on your behalf. And please do not forget to like, to subscribe, to follow us. And feel free to ask that question that you have. We will respond. I know in either 2 or 3 weeks, we should be having a live engagement where we will be opening it up for us to receive questions live from you. And Dr. will be gracious enough just to be able to respond to the same. But may the Lord bless you even as we choose to fulfill. It is actually a godly instruction that multiply, reproduce and multiply. I pray that shall come to pass over your life, over your family and marriage in Jesus' name. God bless you, and please watch out for part 2 that is coming up next week. Asanteni.